Over to Nancy.
Okay. Thank you. I'm Nancy Platts. I'm standing to be the Labour MP in Brighton, Kent Town and Peacehaven. I'm very proud to be supported by the trade unions GMB, TSSA, Unite Unison, RMT, ASLEF, CWU and the FBU. Thank you very much for inviting me along this evening to speak and to sign the pledge. I want to thank Sussex Defend the NHS and Keep Our NHS Public for making this evening happen and for all their hard work so far on this campaign. I also want to pay tribute to the many people who work in the NHS for your commitment and your dedication to delivering a world-class health service. My working life has been devoted to campaigning for social justice. I've worked on lots of health campaigns and I passionately believe that everybody has the right to good health care free at the point of use. And I will fight for NHS services to be returned to the public sector where they belong. And I want to be absolutely clear where I stand. I oppose privatisation of the NHS and I'm going to do everything in my power to stop it from happening. The NHS was one of Labour's finest achievements and we must protect it at all costs. This Tory Liberal Democrat coalition has unleashed a tidal wave of market forces into our NHS with their Health and Social Care Act. They've wasted £3 billion on a chaotic reorganisation that could have been spent on healthcare. The Conservative Member of Parliament, Simon Kirby, must be held accountable for the damage now being inflicted upon the Royal Sussex County Hospital because he voted for the measures that are making it happen. He voted for the Health and Social Care Act that has allowed a free-for-all within our NHS and that's got to be stopped. Labour will repeal the Health and Social Care Act that puts private profits before patients so that NHS professionals can focus on patient care, not competition law. And Labour has also been very clear that the NHS must be exempt from TTIP. We will create a £2.5 billion a year NHS Time to Care Fund to save and transform our health service. We'll support 20,000 more nurses, 8,000 more GPs, 5,000 more care workers and 3,000 more midwives. And by appointing these additional staff, our doctors and nurses will have the time they need to care properly for patients as well as transforming services in communities and at home. Now, I've worked in healthcare charities with people with long-term medical conditions like breast cancer, asthma and diabetes. And what they need is fast access to the best quality treatment that is available, not a postcode lottery in services and increased waiting times. And the result of the Health and Social Care Act is that we've got 6,000 fewer nurses since 2010, A&E waiting times have gone up, and we have competition instead of collaboration. I've recently received some emails from concerned doctors in Sussex because Worthing and Chichester Local Area Clinical Commissioning Group have just privatised their elective musculoskeletal orthopaedic services. And the preferred bidder, which will be responsible and accountable for this service, is a partnership between Central Surrey Healthcare and Bupa. There was nothing wrong with the service being provided in-house. In fact, they'd received a written commendation from the National Hip Fracture Database as a result of their outstanding results. The impact of the Health and Social Care Act on patients is about to be seen. The impact is that if Worthing and Chichester lose their elective orthopaedics to Bupa, the surgeons will leave and they will no longer be able to provide care for patients with broken bones. These patients will then have to come to the Royal Sussex Hospital, not because of some sensible reorganisation like neuro patients moving, but because of the unintended consequences of privatisation. And it's not me saying this is the medical leaders of Worthing and Chichester Hospital, and I've got their emails. And how's Brighton going to cope? At the moment, and I know from talking to staff, the failures of the government reorganisation are showing up in the corridors of the local A&E. Staff are leaving and care is worsening because there is no flow through the hospital because the government have spent the last 3 years privatising and reorganising the NHS as opposed to trying to integrate social care with medical care. Now, this government seemed to be quite happy seeing patients lying for hours in corridors in A&E. They're not waiting to be seen, but they're waiting for a bed. Beds which are occupied by patients who can't go home because social care has been decimated by this government. And this is not just happening here, but throughout Sussex and throughout the country. And once that contract starts, there will be no way that the two hospitals can keep their orthopaedic surgeons. They won't be able to do trauma at their hospitals, and this will be a downgrading of the accident and emergency units, not because of a reorganisation, but the consequence of the local CCG contracting out their service. This is the beginning of the end of the English NHS. We must stand united now to save the NHS. We must put people before profit. So please join me, the trade unions, Sussex Defend the NHS, Keep our NHS public, in the campaign against cuts and privatisation of our local hospital services. Those who fought to save A&E at Lewisham Hospital prove that you should stand up for what you believe in, that you should never give up, and that if you stand united, you can win. From the start of our lives to the very end, the NHS is there for us. Now we need to fight to keep it. Thank you.